Hey everyone, welcome back to the channel. If you've ever switched to a keto or carnivore diet and then looked at your lab results, you might have noticed some numbers that seemed off. Maybe your cholesterol is higher than expected, your creatinine is a little elevated, or your glucose is unusually low. Before you panic, it's important to understand that these changes are often completely normal adaptations to a low-carb, fat-fueled metabolism. In today's video, we're going to go through the key health markers that behave differently on keto and carnivore diets, why they change, and what normal really looks like compared to someone eating a high-carb standard American diet. We'll also discuss a marker called the anion gap, which often surprises people when they first see their labs on low-carb diets. By the way, if you're finding this video helpful, don't forget to like, subscribe, and hit that notification bell for more content like this in the future. First, let's talk about blood glucose and insulin. When you drastically reduce carbohydrates, your fasting blood glucose usually drops, often into the 70 to 85 milligrams per deciliter range. At the same time, your insulin levels fall because your body simply doesn't need to release as much insulin to manage blood sugar. Compare that to someone on the standard American diet, where frequent carb intake keeps insulin elevated throughout the day. Chronic high insulin is a major driver of insulin resistance and eventually type 2 diabetes. On a low-carb diet, lower glucose and insulin are actually a good sign that your metabolism is functioning efficiently, not a cause for concern. Next, let's look at your lipid panel. On keto or carnivore, HDL cholesterol tends to rise, sometimes dramatically, while triglycerides drop sharply. Low-density lipoprotein cholesterol can increase in some people, but there's an important nuance. The particle size usually shifts toward larger, fluffier LDL, which is far less likely to contribute to arterial plaque than the small, dense LDL, common in people eating high-carb diets. In contrast, people on a standard American diet often have high triglycerides, low HDL, and small, dense LDL particles, which is a pattern strongly associated with cardiovascular risk. So while a high LDL might worry some doctors, it's often not a risk factor in isolation for someone in nutritional ketosis. Inflammation markers like C-reactive protein or CRP also behave differently. People on low-carb diets usually see a decrease in systemic inflammation, resulting in lower CRP levels. This is likely due to lower blood sugar spikes, reduced insulin levels, and the elimination of processed foods. Meanwhile, people eating a high-carb diet, especially one rich in refined sugars, tend to have higher inflammation, which contributes to obesity, heart disease, and metabolic issues over time. You may notice slight changes in kidney and liver markers when you switch to low-carb eating. Blood urea nitrogen, or BUN, may rise a little because your body is metabolizing more protein, and creatinine may increase slightly due to higher muscle turnover. These changes are usually not signs of kidney damage. Liver enzymes might fluctuate as well, but fatty liver often improves because insulin-driven fat storage decreases on a low-carb diet. While ketones are not typically measured in standard blood tests, it's worth noting that a hallmark of nutritional ketosis is elevated blood ketones, typically between 0.5 and 3 millimoles per liter. This indicates your body is burning ketones from fat instead of glucose. In people eating a standard high-carb diet, ketones are almost always negligible because glucose is the primary fuel source. Being in ketosis is not abnormal. It's the body functioning exactly as it should in a fat-adapted state. Vitamin and mineral markers also look different. On a carnivore diet, iron and B12 levels are often higher because heme iron and bioavailable B12 from meat and liver are more readily absorbed than the forms found in plant-based foods. Sodium, potassium, and magnesium may dip initially, but they usually normalize with proper intake. Vitamin C levels may appear low, but because lower blood sugar reduces glucose competition with vitamin C uptake, deficiency is extremely rare. On a standard American diet, many people appear to meet the recommended daily allowances, but their actual absorption is often poor due to anti-nutrients in plant-based foods like phytates and oxalates, which bind minerals such as iron, calcium, and magnesium. That's why someone eating a plant-heavy diet may think they are meeting requirements. yet their body isn't using those nutrients efficiently. Hormones also adjust to low-carb eating. Insulin drops, glucagon rises, and leptin levels decrease as fat stores drop. Insulin stores unused energy as fat. Glucagon promotes energy expenditure when you're not eating. Leptin tells your brain when you've eaten enough so you don't overeat. Some people see a mild decrease in active thyroid hormone, T3, which is usually an adaptive change, not a sign of thyroid disease. Overall, these hormonal changes support efficient fat metabolism and energy balance in ketosis. Now let's talk about a lab value that often confuses people on low-carb diets, the anion gap. The anion gap is a measure of the balance between positively charged ions, like sodium and potassium, and negatively charged ions, like chloride and bicarbonate, in your blood. Essentially, it helps doctors detect the serious diabetic condition known as ketoacidosis, or other ionic imbalances. On the high-carb standard American diet, the anion gap tends to be fairly stable because glucose, which has a neutral pH, dominates energy production and the body's acid-base balance. On a low-carb diet, however, the body produces ketones, which are acidic. This can temporarily raise the anion gap slightly. Importantly, in nutritional ketosis, this is completely normal and not harmful, unlike the dangerous ketoacidosis seen in uncontrolled diabetes. So, a slightly higher anion gap on keto or carnivore is usually just a marker that your body is burning fat efficiently and producing ketones as fuel. So, to sum it up, the health markers of someone following a low-carb or carnivore diet often look different than those of someone eating a high-carb standard American diet. Lower glucose, higher HDL, lower triglycerides, reduced inflammation, changes in electrolytes, adaptive shifts in kidney, liver, and hormone markers, and even a slightly higher anion gap are all normal adaptations on low-carb diets. When you understand these adaptations, you can interpret your lab results correctly and avoid unnecessary worry. Just remember that normal depends on what fuel your body is running on, and not just what reference ranges say. If you found this video helpful, give it a like, share it with anyone curious about keto or carnivore health, and subscribe for more science-based breakdowns every week. Thanks for watching, and as always, stay strong, stay informed, and stay carnivore.